Both of those diseases have generated a lot of public concern, and it's understandable. Even though there's only one case of Ebola virus that's been diagnosed in the United States, the level of concern is very, very high. Whereas with enterovirus, many patients have been infected, probably thousands, tens of thousands, or maybe more. So it's a much more common disease, but in most cases, it's not very severe. It leads to severe disease only in a fraction of cases. Even though Ebola is highly fatal, enterovirus ultimately will make many more people sick and may be linked to more deaths than Ebola in the U.S. Well, we don't expect the parents to be able to tell what infection their child has, but we do expect them to understand what the warning signs are and to take some basic preventive steps. So both for enterovirus D68 and all the other serious or potentially serious respiratory virus infections that circulate every winter, including influenza, these are especially problematic for children who have asthma or underlying lung disease. They're the ones who can get critically ill more frequently. So having that asthma under control during the respiratory virus season is really important. Having a good asthma control plan, taking your medicines daily, knowing what to do if the symptoms worsen while you're on treatment is real important to avoid real serious life-threatening complications. The other thing they can do is take simple steps like having good hand hygiene, try and keep the child away from others who are ill, covering coughs and sneezes, and in particular, the more common cause of hospitalization among children during the respiratory virus season is influenza, and that's vaccine preventable.
Right.
So getting vaccinated against influenza is something you can do to reduce your risk. Influenza also can be treated, unlike enterovirus and most of the other common respiratory viruses. So bringing a child in who has complications, asthma, and is exacerbating, to get early treatment can be helpful as well. This is the largest outbreak of Enterovirus D68 that's ever been documented. It's a virus that's been around for a while, but it hasn't spread widely. And we're still learning about what that means, what type of disease this virus causes. We know it can cause severe exacerbations of asthma and lung disease, but mostly mild cases. There's now a potential association with flaccid paralysis or neurological disease. And so with these new viruses that emerge, it takes a while to sort of understand fully, what is the illness that they cause and how commonly do they do that. Because it's not treatable and there's no readily available diagnostic test, and it's not recommended that people test for enterovirus D68 routinely, it's not helpful for clinical management. The key messages are asthma control, good management of asthma, and prevention through vaccination, prevention through influenza vaccination. Well, basically, there have been a number of cases around the country identified with paralysis, and some of those children have had enterovirus infection as well. Now, whether the enterovirus infection was a cause of the paralysis or whether because enterovirus is so common this year, it just happens to be there in these kids, but it's unrelated, is something that's being actively investigated. It will take a little while to sort out. It's a non-polio enterovirus, but we know that some related viruses can affect the central nervous system. And there are a very small number of cases of enterovirus D68 in the past that have been linked to the central nervous system infection. But whether or not it's causing these cases of paralysis is going to take a little more time to sort out.